Thank you all very much. As you know, the subject of our present investigation is human subjects research, and specifically the protection of human subjects, both national and international, with a particular focus on the international dimension. And this panel is brought together to discuss transnational standards of human subjects research, and we're going to begin with John Williams. John Williams is an adjunct professor in the Department of Medicine at the University of Ottawa and an adjunct research professor in the Department of Philosophy at Carleton University, Ottawa. From 2003 to 2006, he was Director of Ethics for the World Medical Association, and during 2007 to 2008, he coordinated the revision of the WMA's Declaration of Helsinki. He previously served for 12 years as the Director of Ethics for the Canadian Medical Association. He is chair of the Canadian Institutes of Health Research Stem Cell Oversight Committee and a member of the UNESCO Advisory Expert Committee for the Teaching of Ethics and the Advisory Board of the Training and Resources in Research Ethics Evaluation for Africa project. Welcome, John.
Thank you very much for the invitation to speak here. I'm going to move very quickly because we have 10 minutes. I see its clock is ticking down now, and there's a lot of material to cover, as I'm sure you're aware. I'm going to pick up on a number of the issues that were dealt with yesterday and hopefully add a little bit to some of the discussion. I think it's customary. It is on? Can you hear me?
Just keep going.
Yeah, it's customary for presentations such as this to declare any potential conflicts of interest, and so I must say that I was director. I'll be speaking about the World Medical Association, and I was an employee there, and I have been a consultant for the WMA since then. The presentation that I'm going to give, I'm going to try to cover all this material, but if I don't in the 10 minutes, then hopefully we'll have a chance during the discussion afterwards to get through to some of this. So I have to say something about the World Medical Association for those of you who aren't familiar with it, to talk more particularly about the Declaration of Helsinki. I want to talk about an issue that came up a lot yesterday, that is the relationship of ethics guidelines versus compliance regulations, and in particular with reference to ethics and GCP, and a little bit about the relationship of the Declaration of Helsinki, GCP, and the FDA, and then my conclusions. The WMA is the International Federation of National Medical Associations. It was established after World War II, mainly in reaction to atrocities involving physicians, especially but not exclusively in Nazi Germany. It is the global representative body for physicians. Its membership includes 97 national medical associations. Now, WHO, of course, has about 200 members, and some of the other health professional associations have larger membership, but not all nations have functioning national medical associations, and there is a big gap with Muslim countries who, up till now, have not shown much interest in joining with their associates in other countries. It works very closely with other health professional associations at the international level and does a lot of work. They do a lot of work together, especially with the WHO, in advancing common causes and things like patient safety and other patient advocacy types of activities. The legitimacy of the WMA comes up especially around the relationship of the Declaration of Helsinki and the FDA regulations, and it doesn't have any legal authority. It's a non-governmental association, international non-governmental association, and so its authority is moral, which is a good thing for this gathering, I think. So what are the sources of the moral association? Well, history, for one, pioneer in guidelines developments. It's only been around for 60 years, but in that time it has established a number of policies that are quite significant on the international level, like the Declaration of Helsinki, Declaration of Tokyo regarding torture, and a number of others, quite a large number of others. It does call upon the experience of its members from all over the world on health issues, and so it's a very good forum for developing international policies. It has extensive consultation, consensus-building experience, and I think there's some contrast to an organization like ICH on that particular point. And then the quality of its policies and activities, which of course can only be judged by others. Okay, the Declaration of Helsinki. I think most people know that it was first developed by the WMA in 1964 after a very long gestation period. Really, work started in 1949. There was a temporary set of guidelines developed in the mid-1950s, but it took until 1964 for the first definitive version to be adopted. There were significant additions in 1975, especially the requirement that research protocols be approved by a research ethics committee. Minor amendments in 83, 89, 96. Major revision and reorganization in the year 2000. I was involved in that. There were a couple of outstanding issues at that time, and they were attempted to be dealt with by notes of clarification. That was not entirely successful. So the latest revision was begun in 2007, and you have the current version now in 2008. Talk a little bit about the influence. Some of this has been referred to yesterday. The ICH GCP require adherence to the principles that have their origin in the DOH. Very strange wording there, because those principles, as many people have pointed out, really didn't originate in the Declaration of Helsinki. They were stated there, but clearly they come from earlier sources. And other documents have followed the DOH. The FDA, of course, has recently eliminated reference to the Declaration of Helsinki. We'll talk about that later. In terms of its influence, there's been a couple of studies done in Africa as to what documents are used by research ethics committees there, and the Declaration of Helsinki is named first by a long shot in these particular surveys. And the Standing Committee of European Doctors issued a resolution calling for compliance with the Declaration of Helsinki. And there are many other documents that could be cited and examples that could be cited about the influence of the... So it really is often referred to as the grandfather or the premier document on research ethics. We have to remember it's a very short document, 3 pages compared to CIOMS, which is close to 100 pages, compared to our Canadian new version of the Tri-Council Statement, which is 200 pages. And so it clearly is a summary of research ethics. Regulations versus guidelines. Well, very simply, the way I see it is regulations and laws, what must be done under pain of penalty. Ethics is what should be done, even if it's not required. I did speak to an International Association of Compliance Professionals. These are mainly employees of pharmaceutical companies and also employees or people who work for consulting companies like KPMG. And this is a very large business of helping the companies, the sponsors of research, really to comply with the multitude of requirements, regulations, and laws all over the world as clinical trials really expand in a global manner, as we heard yesterday. And I think they're quite aware that it's not enough just to do the minimum, that there are advantages to doing more than the minimum to be ethical rather than just compliant. Values, of course, are important, but reputation, and the reputation of many of these companies have suffered a great deal because of breaches of not only ethics but laws as well. Okay, so some of the international ethics guidelines, the WHO operational guidelines for ethics committees, that's currently under review, and there should be a new edition out fairly soon. CIOMS we'll hear about, and Declaration of Helsinki. The principal, did I miss something? The compliance guidelines, ICH. Now, it's called a guideline, but really it's incorporated into national laws and regulations, so it really becomes much more than a guideline. It becomes a regulation, a set of regulations. And in Europe, too, there are international, I'm talking only about international documents here. Now, let me just move on to the relationship of ethics and clinical practice. And I want to, in particular, in the time that's left, which isn't very much, to compare and contrast the DOH and the ICH GCP. And there are a lot of similarities, and that's very good. But the difference is that there are important omissions in the GCP, and one of the reasons for that is it's very old. It goes back to 1996, 2010, and some of the things that we find in documents such as the Declaration of Helsinki, which are not in GCP, are research on human tissues and data, including the important matters of privacy and confidentiality there, consideration for the environment, access to benefits, and that's a big issue that you'll want to address, I think. Role of families and communities, clinical trial registration, which is dealt with in other documents. Who should seek and obtain consent? The assent of incompetent research subjects, publication of results, especially negative results, enrolling patients as research subjects, the possible conflict of interest there of health professionals, and therapeutic innovations and how that relates to research. So there's a lot of things that reliance on ICH GCP really doesn't get far enough in this day and age. We can talk more about the FDA and about placebos, about access to benefits. And so just to move to the conclusion, I think it's important to note that the congruence of some issues in compliance and research ethics shouldn't mask the different interests that are at play. And clearly there are very different interests between industry and health or protection of research subjects, and that should be acknowledged and be upfront. I could save this for later, the one take-home point, but I'll say it now. Interests of research subjects, whether individuals or communities, should prevail over those of researchers, research institutions, commercial enterprises, sponsors and funders, and I think all stakeholders should aim for the highest ethical standards. Thank you.
Excellent. Thank you very much, and you're welcome to repeat it and elaborate on it later. So thank you, Dr. Williams. Our next speaker is